how far or close do you think we are from getting universal health care? Do you anticipate seeing it in your lifetime, perhaps?
I'd like to see it in the next election cycle. I don't know what the weight is. As Tony Benn said, it's like it's like giving women the right to vote. That took us, 140 years from the founding of this country before women had the right. It's not even 100 years yet, is it? Since women have been voting, 1920. I'm sure at that time, if we went back and studied the history, they probably talked about how can we do this in increments. We want to ease people into this. Sometimes you just have to jump in because it's the right thing to do. And making sure that we have universal health coverage is the right thing to do. And it will happen if people rise up and demand it. And as our Canadian friend, a member of the Conservative Party there in the film, said, once people decided they were going to do it, they just did it. They didn't at first like the idea. And then they figured, you know what, this is a good idea. And let's quit being manipulated with fear, calling it socialized medicine. We pay for a lot of things with our tax dollars, and we offer them as free services because we consider them vital to our survival. We would never expect the fire department to turn a profit, right? You wouldn't. I mean, if the Senator, you gave a good example there at the hearing today about it. Imagine if the fire department showed up and said, well, we'll run the water for 5 minutes, it'll cost you this much, and then if you run it 10 minutes, it'll cost you that much. Tony Benn actually told me a story that in England, back in the old days, they actually used to have fire insurance where in order, if for the fire department to put out a house fire at your house, you had to pay for insurance. And they would put a plaque on your door that said you were covered. So let's say, for instance, your house caught on fire, fire department show up. If there was no plaque on the door, they just let the house burn. And he said, but what would happen is that not only your house burned, the people next door might have had the plaques, and then their houses would burn. So it was a crazy system. Well, it's a crazy system to allow so many of our fellow citizens to get sicker and sicker, fall between the cracks, only create a worse situation for everyone. And I would say to the Republicans and conservatives here in California and elsewhere, but this is a conservative issue too, that you end up paying more for this in the long run. And if you don't have your employees covered by health insurance, it hurts your productivity. Because when somebody doesn't have health insurance, they don't go to the doctor, and then it just gets worse. Or they come into work sick and get everybody else sick. There's a way to frame this to conservatives where I think at least some of the clearer thinking ones will understand this and realize, I know I'm in a hopeful phase right now. Please, humor me for just a little bit. But I've just got to believe that there's some common ground that we can find with people who are not of our political stripe. And I think if we do that, we're going to be successful with this issue. And as I said earlier, the governor of your state knows better than anybody because he was able to come to this country with that great body that he had, great healthy physical thing that he had going on. And he came that way because he came from a country that had free universal health care. And I'm sure that he and his family took advantage of it, and it meant a lot to him during his years, and he should give to the people of California that which he got as a young man in Austria. So when you're speaking to Arnold, don't call it socialized medicine, just say you want Austrian medicine here for the people